Mr. Mancini. My name is Luke. I'm a level 2 nursing student at McMaster, and today I'm going to help you by putting in an indwelling catheter.
Mr. Mancini, before we begin, we need to confirm your identity. Can you please tell me your full name and date of birth?
All right, Mr. Mancini, we're going to be putting in an indwelling catheter today for you because you've had discomfort and difficulty urinating. For the past 8 hours, you haven't urinated at all, so we're going to help you out with that. The process of inserting a catheter may be uncomfortable for you, but it shouldn't be painful. Before we begin, do you have any questions? Mr. Mancini, I'm going to start by palpating your bladder. Alright, there's slight distension in your bladder, which makes sense as you haven't voided in the last 8 hours, and the bladder scan showed that you had 630 milliliters in your bladder. Alright, Mr. Mancini, I'm standing on the right side of the bed because I am right-hand dominant, so it makes it easier for me to not reach across you and perform this procedure correctly. I have you laying in the supine position with your legs slightly abducted for more comfort. Supplies to create the sterile field. I'll remove the catheter tray from its bag. Here. I'll take off the top by only touching the 1-inch borders, starting with the top, the side, and for the last bit, I'll be using the forceps to bring them back, taking the first cloth out, keeping it on the sterile field, and taking the gloves out so I can don them. Now I'm going to insert the catheter into the sterile field, so I'll only be touching the outside of the catheter and putting it into the sterile field. And now I'm going to do hand hygiene. Since I'm right-hand dominant, I'll be inserting my right hand glove first, and so I'll be touching clean to clean, and then once I have the other glove on, sterile to sterile. So I'm touching just the cup. Inside of the cup. And then touching sterile to sterile, this glove. And next I'm going to drape the patient, putting the shiny side down. And then I'm going to take the fenestrated drape and place it over the patient just so their genitals can be exposed. Alright, Mr. Mancini, I'm going to start by cleaning just the tip of your penis. And so I'm going to start by taking out the cotton balls, putting the iodide solution on it. And this time I'm going to take out the lube and pour some on here, as I will have 2 sterile hands after I touch his penis. And then take tweezers and make sure the iodine is covering the cotton balls. And then, so I'm going to grab the cotton balls and start grabbing the shaft of his penis and going outwards in circular motion, starting closest to the urethra. Again. One more. Alright. Now that this hand is unsterile, I have to keep it here for the rest of the procedure. Alright, Mr. Mancini, now I'm going to insert the catheter into your urethra. I'm going to place this tray over here for the urine collection. And I'm going to take the 12 French catheter, which is 5 cc's. It's the right size for you. You shouldn't feel any discomfort, but if you're experiencing any extreme pain, let me know. I'm going to lube up the tip of the catheter about 2 to 4 inches, and then I'm going to insert it into your urethra. I'm going to hold your penis perpendicular for the easiest access in. Alright, I see some urine flow out of your bladder, so I figure that the catheter has reached the bladder, but I'll push it another 2 inches approximately in, just to be sure. Alright, now I'm going to take the 5 cc's of sterile water, and I'm going to inflate the balloon so that it'll stay in place for you. Right. So I'm just going to give it a light tug. Let me know if you experience any pain or anything. Alright, so I feel some resistance in the bladder, so that means that the catheter has reached all the way there and is securely in place. I would then attach this section of the catheter to the tubing, which would bring it to the catheter bag, which would be attached to the side of the bed somewhere where it's non-movable, and then I would attach the section of tubing to the guy's leg. Are you experiencing any pain, Mr. Mancini? No, Mr. Mancini isn't experiencing any pain. Mr. Mancini, it's Luke. I'm back to take out your catheter. I'm going to put on clean gloves because this is not a sterile technique anymore. You've been voiding very well. You've been having more than 30 milliliters per hour, and so we believe, and the doctor has ordered that the catheter be removed, and now you can void by yourself. So what I'm gonna do is I'm gonna place the pad underneath here so we avoid any spillage, and then I'm gonna deflate the bulb of the catheter. It is a 5 cc catheter, so I'm going to take 5 milliliters out. Alright, 5 milliliters of water is out. So Mr. Mancini, I'm just going to have you take a deep breath in, and when you exhale, I'm going to pull the catheter out, alright? Go. The catheter is out, and now I'm going to inspect his penis to see if there's any swelling, redness, any lesions. There doesn't seem to be any of those. So now I'm going to take the pad and the catheter and dispose of it in biohazardous waste. So for the purpose of this video, there's no catheter bag, but if there was catheter bag, I would take the measurement and then empty it into a blue urinal and put it into the toilet. And then, so now I'm just going to go wash my hands because I have the chance of coming into contact with bodily fluids. So using this hand washing technique is the best way to prevent illness. And for the documentation, I'm going to document the time that the catheter was removed, the amount of urine that he's voiding, and if he's in any discomfort. Mr. Mancini, are you in any discomfort? So, do you have any questions for me before I leave? Alright, have a nice day.